frontline workers that weren't consulted, they came to the committee. Unifor, SCIU, OFL, QP, ONA, all came to committee. Every single one of them said, repeal Bill 24. Stop fighting healthcare workers in court. Every single one of them. Every single one of them was asked, did anybody consult you or your members? The answer was no, didn't happen. No collaboration. And they actually came with solutions. I only have 5 minutes left, so I can't read through all the committee transcripts, although I did print them off, just in case. But they came with solutions that this government just doesn't want here. Because they want these shareholders, friends, donors maybe, I don't know, to make all kinds of money. You know, the member opposite, he's not the only one, the member for Durham. We heard it all through a committee. We hear the talking points from the government side when they talk to this bill about it being innovation. I've said it every time I've had a chance. Privatization and profitization is not innovation. It's a cop-out. It's taking us backwards. I stood here in this place a month or so ago and talked about how universal single-payer health care came to be in this province and in this country not long before I was born, in my early 50s. Before that, it was privatized and it was profitized. It is the oldest game in the book, and it is a cop-out. If the government would stop attacking healthcare workers, would repeal Bill 124, would actually invest in our publicly funded, publicly delivered, not-for-profit system, we could address these backlogs. The workers within the system are telling you it can be done. You just need to give them the tools to do it. And again, I want to point out that the government is funding these private for-profit clinics, shareholder-driven clinics, more than they are our publicly funded, publicly delivered, not-for-profit healthcare system. These clinics can do more surgeries, not because of capacity, but because the government gives them more to be able to have the staff to be able to do that. And the last thing that I want to say, as I see my time is running out, is there's great concern around upselling. It's already happening. It's already happening. Where people are told, this is what you need. You know, here's your medical condition. We can address that condition. Here's kind of like the basic thing, but hey, this is better and you should have this. It's preying on vulnerable people. Vulnerable people who just want care. They just want to feel better. They just want to see better. They just want to walk better. That's what they need. They want it out of pain. And they're taking advantage of in many of these clinics. Not all clinics, I want to be clear, but in many of these clinics. And you're opening the door for more of the people to do just that, to take advantage, because there's no oversight. But I want to make it clear in the last couple minutes that I have, Madam Speaker, I think most of the people in this province were left out of this conversation because you rushed this bill so quickly. I said you should be traveling it, you didn't. You pushed it through as quickly as you possibly could so that people wouldn't have time to know what you were up to. And that is absolutely shameful, because it will affect millions of people in this province. Millions of people. Many of those will be excluded from being able to get the care they need in a timely fashion. This is private, for-profit, shareholder-driven decision-making is what this is. And the government side will say it's about, the name of the bill is your health. They'll say it's about your health and you accessing health care faster. You'll get it with your OHIP card, not your credit card, which we know is not accurate. It's already happening, people are paying. But what I want to say to the people in my riding in Windsor West and across the province, this is not about your health. This is not about your health. This is about their wealth. This is about the wealth of shareholders. This is about the wealth of corporations and enriching them and making life better for them. This is not about your health. If the government really cared about your health, They would invest in the publicly funded, publicly delivered, not-for-profit system that we have now, so that people get the care they need when they need it. If it was about the health of the people in this province, you would be investing in the frontline workers, in the publicly delivered, not-for-profit system. You are purposely trying to collapse a healthcare system that reaches all of Ontarians and cares for all of Ontarians for the sake of pushing your privatization agenda.
It's now time for questions. I recognize the member for Durham.
Thank you, Speaker. Speaker, our government has launched the largest healthcare recruiting initiative in Ontario history, in addition to the thousands of new healthcare workers, including nurses.
That is only because so many of them are leaving. Why is that? Because you keep on friggin' suppressing their wages. You wouldn't work for a 1% the person that just got in charge to the top job of the London Science Health Center had to have her wages raised to 42% just to get to not even $1 million. So that shows you, because she used to be, a nurse, that shows you exactly how little they get paid. That's a huge increase to wages, and it didn't even equal to $1 million. So there you go. If I was her, I would just maybe share some of that with my employees, because that makes a problem. That doesn't matter. Anyways.
Who have been hired in the past several years. We are on track for thousands of more healthcare professionals to be recruited and placed in our healthcare system across the province. That's more doctors, more nurses, more personal support workers. And so my question for the member opposite is, will she and her colleagues support the future of our publicly funded healthcare system by supporting Bill 60?
Back to the member for Windsor West for response.
What I can tell you is this: I support you repealing Bill 124 and not attacking healthcare workers in the publicly funded, publicly delivered, not-for-profit healthcare system, sir. I will never support a healthcare system that is driven solely on shareholders making a profit at the expense of the people that simply need medical care. We've seen what's happened in long-term care with it profit-driven system. Are you proud of the record of 5,400 people dying in long-term care because profit was put above care? That's my question to you.